Hello and welcome. Bore da, croeso. My name's Sally Lewis. I'm the National Clinical Lead for Value-Based Healthcare in Wales, and I'd like to welcome you to the first day of Value in Health Week 2021. We're joined today by an illustrious panel of guests to help us open a week that's packed with content. We have Ifan Evans, who is the Director of Technology, Digital and Transformation at Welsh Government. Ifan has a very broad portfolio, and we're very excited for him to be Welsh Government sponsor for Value in Health. We have also Helen Thomas, who is now Chief Executive of Digital Health and Care Wales. And that's really to acknowledge the critical role that digital health plays in value-based healthcare, both in terms of the information we need to support value, but also in terms of the patient-facing technology that we need to take forward this transformation of care. And later we are also joined by Eluned Morgan, Minister for Health and Social Services, and Paul Mears, Chief Executive of Cwmtaf Morgannwg University Health Board, who is now the executive sponsor of Value in Health. So without further ado, I'd now like to hand you over to Ifan, who's the first of our panelists speaking today.
Diolch yn fawr iawn, Sally. Mae'n bleser iawn gen I fod fan hyn pnawn yma. Mae'n blynyddoedd yn gweithio ar gofal darbodus a gwerth mewn iechyd, a mae fe'n bleser tu hwnt I gael gweld yr wythnos sydd gyda ni o'n blaenau. Thank you very much indeed, Sally. It's a great privilege to be part of this week. It's a very, very exciting, packed agenda of things. My job here is just to sort of try and briefly describe how we got here. My brief is, what's the policy and the strategy context. So I'm going to take you back 7 or 8 years into maybe the origins of our first engagement with value-based healthcare in Wales. And I'm sure you'll see several of the themes that I'll talk about coming through in the presentations if you've had a chance to look at the agenda for the week that we have ahead. And the Minister should be joining us at around 11:15. So if for any reason she is delayed, then you'll be hearing a bit more from me. So let's hope that she's on time, eh? Looking back a few years, Wales first really got involved with value-based as part of an international movement. And we were using the phrase prudent healthcare. And the now First Minister, Mark Drakeford, was a very, very strong personal champion of prudent healthcare as a set of principles and as a new framing of the challenges in health and social care, very much supported by the Bevan Commission and by Professor Mansell Aylward, chair of the Bevan Commission there, and the Bevan Commissioners. And they do say culture eats strategy for breakfast. And I think it's a good thing that we started off in Wales with that very broad sort of cultural approach to talking about what the underlying principles that we wanted to change were and what some of those values that underpin the things that have moved into value-based healthcare. And values are not quite the same as value-based healthcare, as many of you I'm sure will know because you'll all be familiar with the agenda. So in 2014 through into sort of 2016, 2017, Prudent Healthcare set out a number of sort of animating principles, we'll call them, about working in equal partnership between professionals, patients and the public, prioritizing services on the basis of need, particularly clinical need, only doing what is needed or minimum appropriate intervention, only do what only you can do, a coinage from Mark Drakeford, or operating at the top of your profession. And then finally, an area that I was particularly interested in and have become even more so, using data, information and evidence to reduce inappropriate variation across what we do. All of those things feed through into what we have today. We haven't lost any of those, but Value and Health Programme, value-based healthcare, I would say, has sharpened up and moved from a sort of a principle space into more of a strategy and increasingly into a structured delivery program kind of space. And a really important part of that was the publication in 2018 of A Healthier Wales, which is the health and care strategy, a new health and care strategy for Wales. And it was a health and care strategy. It's the first time in Wales that we published a joint strategy for health and care together. Historically, we'd had NHS strategies, which inevitably drifted into the need to address social determinants, to have more emphasis on prevention, on patient self-management. And this was a different framing. And there are quite a few things in that which I want to draw out. And if you have the time, it's available online. It's only 30 pages or so. It's quite an easy and quite a short read, very consciously so. It talks about value, about linking value together with quality. So it uses the framing of quality and value. Wales, for many years as a system, pushed really hard on quality and safety. Linking value into that as let's call it an evolution of what quality is, but pairing those two things together so that we could carry on doing the things that we've been doing very well, but bring a different value-based lens or interpretation to it. It's really strong in the document about what are the key enablers for transformation and change. It's easy to set out what you might want to achieve, but what are the key enablers there? And data and digital, but also the workforce and stronger national planning and direction are key ones. Helen will talk later about data and digital ads with a number of presenters through the week. But some really important changes there, and I think in the last couple of years we've seen a real step change in where we are on data and digital. And I know that clinical leads like Sally have been very much involved in PROMs, PRAMs, and other things. And again, you'll hear a lot about those. The Healthier Wales sets out kind of a bit more of a mechanism about how you make change happen in very large, complex systems, which is what health and care is. There's a lovely little pyramid diagram in there. So you start with local pilots, scale the ones that work. You evaluate as you go. You scale those up to regional demonstrators, and then if that works, and you tweak and adjust them again, you kind of productionize them and you scale them up to national deployment. Now, value-based healthcare and Aaron Bevan Health Board has been really strong in terms of leading in the early years on value-based healthcare as a kind of a regional demonstrator and a step up. Over the last 2 to 3 years, though, we've absolutely gone national. You'll see presentations from every one of our health boards today, different projects in different health boards, but all of them with the potential to go national. And it's good to have this kind of mechanistic conveyor belt, a good way of stepping up. Otherwise, the task in front of us is just too large. The way to eat an elephant is one bite at a time. I'm going to bring as many strange quotes in as I can just to keep you entertained on a Monday morning. There's also quite a lot in there around working with university and industry partners. And we've always done that, but not always with a sort of strong national level of endorsement. We've worked on projects with pharmaceutical companies and med tech around partnering on the basis of outcomes achieved, outcomes-based commissioning, reimbursement. There's a real challenge. It's not easy to do. The industry wants to achieve it. Healthcare systems and providers want to achieve it, but there's a lot of detailed work which is needed, and particularly a lot of confidence in data is required for those. And Adele Cale will be talking about value-based procurement in Wales and a few other things over the next few days. But all of that, those are tools for doing things, and value-based is still in there talking about the things that we are seeking to achieve more than anything else. There's a great deal in the document, in the Healthier Wales as a strategy, about shifting care away from hospitals, shift to the left into primary community care and prevention, especially into prevention and self-management, earlier intervention, earlier detection, better, more accurate diagnosis, in order to give you choices about how you intervene. And those choices, ones that should be informed by a conversation with patients, but also about the outcomes which matter most to them. Lots of examples, many of you will be familiar with, I'm sure, some around sort of prostate cancer, but even really down to earth stuff about hips and knees and replacements. What is it that those often very elderly patients really need? They want to be able to do the gardening, and it doesn't necessarily follow that a new hip will help them to do the gardening. It may be that some physio and even taking up yoga would help them to garden more efficiently, or other mechanisms. Some of them not even health interventions, not because I'm old, it's just because I'm lazy, like having planters that are up on legs so that you don't have to get down on your knees in the first place, because the planter sort of comes up to you. So there are lots and lots of other interventions that are a holistic approach which takes into consideration lots of different approaches and responses can consider. And all of this is kind of boiled down in the document in a Healthy Wales to a couple of key phrases that pay. One is about a whole system approach to health and care, how we look at all of the options that are available to us and make more intelligent choices about what we're able to offer, and also more informed ones about the conversations that we have with patients and the public when they come to the health system and the care system looking for support. And secondly, about new models of seamless local health and social care. That's the sort of phrasing which is in there. Digitally enabled data, which is portable and transparent across health and social care. But the really important thing being that it's seamless from the perspective of the patient. So not from our perspective as professionals that we're all one workforce. It doesn't help if we're working in silo-based approaches and we have fragmented systems and we force the public to navigate through them. It's about making the services all joined up at the front end for the individuals that need to access those more than anything else. And I would say that Healthy Wales, published in 2018, it faced an unexpected test, shall we say, when the COVID pandemic struck about 18 months ago. It's a real test of a strategy that you've published a year and a half before when something like that happens. Seismic shocks, unprecedented, genuinely unprecedented. But I would say that overall, we've seen a reinforcing or a validation of what it says in a Healthier Wales. Now, there are some things that have been slowed down, compromised perhaps, because there's a big portfolio of activity, 40 separate actions in a Healthier Wales that we wanted to drive forward. And when you put the sort of load onto a healthcare system and a profession and the workforce that we have that have done truly amazing things in the last 2 years, something has to give somewhere. But on the other hand, it also drives the pace and acceleration in other things. And we have seen a big change in digital services. Digital is an enabler of service delivery, remote consultations, remote working for clinicians. But if you look at the tools that health authorities have used in response to COVID, digital has been very, very prominent indeed. Whether that's the COVID-19 proximity tracking app, or whether that's online booking and requesting of tests, or online booking of vaccine, and all sorts of other things, digital has really moved into the front, and so has data. We've been working on weekly and daily stats reports on prevalence, on positivity rates, and on other things, and they very, very directly inform policy choices around planning, around allocation, even about public health interventions, in ways that for decades we've described we should be doing, and we've been forced to do it. And I think everybody is determined to hold on to those things. And the other thing is that it's been a profoundly preventative set of interventions. We do everything that we can as a society, in fact, to avoid people getting COVID, particularly extreme or acute COVID, in the first place. If they come into hospital, that's the thing that we're seeking to avoid. So social distancing, proximity tracking apps, masks, all sorts of other things, they're all fundamentally very, very preventative, and they're all things that are in the hands of individuals and public self-management. Now, all these things are completely in tune with value-based healthcare. The more we can shift away from professional intervention after the event to people owning and being responsible for and taking action to manage their care, then the more we're moving towards enhanced value. Less cost on the intervention, but less, let's call it harm, damage. Inevitably, there's harm for major interventions in health and care can do a lot. If we can stop people becoming ill or identifying illnesses and other conditions very, very early on, then it's far easier to stop them. So here's another quote from my grandmother: "Stitch in time saves 9." These things are not new, right? And I think that's my main theme here. That 7 or 8 years, Wales has been working on prudent healthcare. The last 2 or 3. It's been great to see the validation that we've had, World Economic Forum and other things that you'll hear from. It's great to see all of the projects that come through. This is not all brand new stuff. It's not, it's not groundbreaking invention. This is about doing things that we know that we need to do. But a programmatic approach is about the machinery of how we get it done, the discipline of how we get it done, giving it the recognition, the profile, and other things about making sure that we can make the change even under a really, really intense pressured environment. So I'm going to try and just cover one example. I can see that the minister's just joining, so I'm just going to talk very briefly about renal as the minister joins us. give her a minute to settle in. So, and I don't think renal is one of the examples. So I saw with Sally and with Paul, the chief executive, and I should actually just thank everybody who's been involved in all of this, and the power of having an NHS chief executive, clinical lead, and Welsh Government policy all lined up in one place through a programme. We saw this fantastic presentation about renal dialysis, and particularly about moving it from a facility delivered model to a home-based model. And very briefly, it costs half as much to deliver at-home renal dialysis. If you track the outcomes, and it's a fairly basic, simple approach, EQ5D, people's well-being is very significantly enhanced for people who are receiving renal dialysis at home. So they get better mental health, they get better physical health, they get more independence, they have more confidence, and it costs the health system half as much. So you would think this would just take off, but it doesn't. And it doesn't because, as I said before, culture eats strategy for breakfast. It doesn't because people for decades are conditioned to take a great deal of confidence from the professional support that they get. They feel safer when they come into a medical facility, even despite the evidence. So that is just about how much work we have to do. It's not all data, however important data is, and it is really, really important. It's not all our decisions. It's essential that we take the public with us and help them to understand the value and the benefit that they will get from working in different ways. So there's so much exciting stuff happening across the whole of Wales. I hope you can stick with us for the whole of this week, because just look at the programme and see all the examples and all of the fantastic stuff that is there. So diolch yn fawr iawn am wrando, diolch yn fawr iawn Gweinidog am ymuno ar amser bore dydd Gwener. I ni just yn dechrau nawr. It's a great privilege to be able to introduce Eluned Morgan, the Minister for Health and Social Services, for the keynote speech for Value in Health Week, and I hope you have a fantastic week ahead of you. Diolch. You're on mute, Minister.
Sorry, is that better? Great, diolch yn fawr. Bore da, dwi'n falch i allu ymuno gyda chi wrth i chi lansio wythnos gwerth yn iechyd 2021 a strategaeth newydd iechyd a gofal seiliedig ar werth yng Nghymru. I'm really delighted to be able to join you as we launch our Value in Health Week 2021 and the updated strategy for value-based health and care in Wales. And I want to start by thanking all of you for working across the health and care sector in this incredibly difficult time. And your unwavering public service over the past year and a half has been absolutely vital in ensuring that we've been able to navigate the challenges of COVID-19. But I know that even with ongoing pressures, you're here today because you're passionate about making health and care in Wales the absolute best it can be. And I really want to thank you for your commitment to improvement and the collective expertise you bring to this conversation. A croeso, welcome to the many of you who are joining us from outside of Wales, who are following, I know, what we do here in Wales with interest. And I want us to keep on building our reputation as a leader in value-based health and care. Now, this leadership was recognised this year by the World Economic Forum in selecting Wales as one of 4 global innovation hubs and as the only country applying a value-based approach at a whole system level. Now, this week offers a wealth of opportunities for discussion and new ideas on how we can continue to develop health and care to ensure better outcomes and experiences for every person in Wales. We need to work out how we take full advantage of technological advances to improve outcomes for the people that use our services, and how we maximise collaboration with industry and academic partners to allow innovation to flourish. It's a vital conversation, particularly as we look beyond the immediate pressures of COVID-19 to how we can make our whole health and care system better integrated, more sustainable and resilient to the challenges of the future. Now, this is the vision we set out 3 years ago in Oh Healthier Wales, our long-term plan for integrated health and care. We described our strategic approach starting from a foundation which we describe as prudent healthcare, bringing quality and value together, and using key enablers like digital technologies and investing in our people. Now, this is a whole system approach focused on health and well-being and on preventing illness. It's a vision that has withstood the test of the past year and a half and remains relevant as we move to a new phase of our COVID-19 response. But to realise this vision, we must have a clear line of sight to our health outcomes, to the impact of the services we're providing. By understanding the differences they make, we ensure that services provide the greatest possible benefit to those that need them. And this is how we'll get the most out of our investment in health and care for the population of Wales and make services sustainable for future generations. This is where a value-based approach to health and care is essential in driving forward the transformation we need. A value-based approach ensures that our focus always remains on improving outcomes. It keeps us fixed on what matters, looking beyond our healthcare activity to whether that activity has a meaningful, positive impact on people's lives. For someone with heart failure, this can mean earlier diagnosis and better community management, or meeting someone's preference to remain in their own home when they require end-of-life care. Now, these pathway improvements are not only beneficial to health and well-being of that individual, evidence tells us that they're also a more effective and efficient way of providing care. Now, we already have compelling evidence around high-value models of care across a range of conditions, and we now need to embed these quickly to ensure the adoption of proven good practice across the whole of NHS Wales. This is an ambitious culture change, and my expectations for health boards to accelerate their shift to a value-based way of working are high. But we have the tools we need to drive this forward, and the time to use them is now. COVID-19 has been a catalyst for change in how we deliver services in Wales and saw us rapidly accelerate the implementation, for example, of digital solutions. We want to build on successful new ways of working, like our All Wales video consultation service, which has enabled people to continue to see healthcare professionals whilst remaining at home. More than 12,000 professionals across 100 specialities in primary, secondary and community care are accessing the system. And it's being extended now to dental, community pharmacy and to optometry. I want to maintain this pace and scale of change as part of our recovery from COVID-19 to ensure we deliver the best possible outcomes for patients and the public in Wales. Value-based health and care is a key policy objective and our wider innovation programme for health and social care. We'll continue to explore the potential of new digital technology to support people to stay well, to find and access the right care at the right time, to engage with health professionals and to have the tools that they need to manage chronic conditions. Data, we know, is a powerful driver for change if it's presented in the right place at the right time and in a visually accessible way. The Value in Health programme has shown how data on patient outcomes can be used to support better decisions on how we allocate our resources and strengthen our preventative approaches to conditions like diabetes. Extending the collection of outcome data in health boards and sharing this information nationally will enable meaningful analysis of our health outcomes at a population level. Alongside these digital and data enablers, we have strong leadership to embed a value-based approach across our health and care system. Clinical appetite and enthusiasm to adopt a value-based methodology is clear, and Paul Mears' appointment as lead chief executive for value-based health and care provides important additional strategic direction. Paul has consolidated the Value in Health programme within the newly established Welsh Value in Health Centre, providing a strong base from which to grow our reputation for world-leading knowledge, evidence and research. I'm really pleased that the refreshed strategy being launched today is structured around 6 enablers for the health and care system, with the Welsh Value in Health Centre driving change on a national level to make it easier to embed a value-based approach locally. The Centre's focus on working through delivery challenges at an all-Wales level will help to support local innovation and the spread and scale of local exemplars. Within this strategic framework, building on existing leadership and good practice and taking advantage of new digital tools, we're well placed to realise our ambition of a data-driven health and care system, a system where staff at every level have readily accessible information on patient outcomes to support their decision-making and service design that meets true need across the whole pathway of care. The future we want for our health and care services is within reach, and I look forward to working with you to make that a reality. Dwi'n edrych ymlaen yn fawr at weithio gyda chi I drawsnewid ein gwasanaethau iechyd a gofal, a diolch yn fawr am wrando a gobeithio wnewch chi fwynhau yr wythnos. Diolch.
Minister, diolch yn fawr. Thank you very much indeed. Powerful words, and we're so grateful to you for joining us this morning and helping us open Value in Health Week. We know you've got a very busy schedule, so thank you so much for joining us. Now I'd like to move to a short recording from Paul Mears. Paul unfortunately can't join us in person today, but he's recorded some words for us to listen to as he takes up the mantle of executive sponsor for Value in Health.
Hi, I'm Paul Mears, Chief Executive at NHS Wales Health Board, and I'd like to welcome the Welsh Value in Health Centre to our organisation. I know that the Value in Health programme has made huge progress over the past few years, embedding a value-based healthcare approach across the whole of the NHS in Wales. And we're really privileged to be hosting this programme, which has already been recognised internationally for its work across Wales. And it's really exciting for us here at Cymdeithas Morgannwg to be hosting the organisation now moving forward and helping embed the value-based approach across the whole of the NHS in Wales. I've no doubt that the team led by Dr. Sally Lewis will continue to go from strength to strength as they deliver the area focused in the strategy that's just being launched. And I'm really excited to have the opportunity as the lead chief executive for Value in Health in Wales to work with Sally and her colleagues to drive this agenda forward across the whole of the NHS locally. Many health boards and trusts in Wales have already set up dedicated teams to focus on value-based healthcare, and it's really great to see some of the innovation and ways of delivering value-based care that are already happening across the NHS here in Wales. However, we all know there's lots more to do and lots more opportunity for us to grow and develop this approach to be much more embedded in the way we deliver services here in Wales, particularly at these challenging times where we're still dealing with the COVID pandemic, and also trying to catch up the backlog of elective surgery that we're all wrestling with across the NHS here in Wales. Under the stewardship of the Value in Health Centre, I know that teams across Wales will carry on and delivering the initiatives they're doing and also improving the outcomes that matter most for our patients, our staff and our communities. I'm really looking forward to working with the team, providing the strategic oversight and guidance to them and support as lead chief executive, and looking forward to seeing how the importance of value-based healthcare is really embedded in the success and sustainability of the system here in Wales. Thanks very much.
Thank you, Paul. And I'm sure you'll agree that we're starting to really bring together all of the elements of the system to really get behind value-based health and care in Wales. And on that note, I'd now like to introduce our final guest, Professor Helen Thomas, who is now Chief Executive of Digital Health and Care Wales. Hello, Helen. Helen and I have been friends and colleagues for many years, and I've asked Helen to come onto the panel today really to highlight the critical role of data and digital in delivering value-based health and care. So welcome, welcome, Helen. Thank you very much.
Thank you, Sally, and delighted to be here this morning. So good morning, everyone. Bore da pob. Pan mai data a digol and ganoleg I raglen hon. That's the first and last time I'll try and speak in Welsh this morning. But why is data and digital pivotal to this programme? I think I'll be so bold as to say that without data, you can't deliver a prudent value-based healthcare approach. Data is the foundation of a value-based healthcare system, and indeed we've heard this morning both from Ivan and from the Minister how important data and digital is to achieving a truly value-based system. We've got lots of data in Wales in the NHS, but historically I'd say that we have perhaps limited information and little intelligence and insight from that data. We've measured what we could measure, the inputs of a care process, by definition, process data. Arguably, we're pretty good at it, to be honest, particularly in hospitals. We're good at counting that granular level of hospital activity, less so out of hospital. And actually, that can give you a really good descriptive analysis of what we've done. But what it won't tell you is how well we did. It won't tell you whether those inputs and interactions actually resulted in a good outcome. So we need both the process and the outcome data, along with good financial data, to really provide the full picture for us. Because collecting more relevant data and using the data in far more sophisticated ways than perhaps we've done historically really does provide that opportunity to understand outcomes and experience, can support personalised care, better informed care, patient safety, planning and policy evaluation, understanding the burden of disease and improving diagnosis and prevention, and of course research and development into new treatments. So truly really enabling the core principles of prudent healthcare. We've heard a lot about that this morning. To understand variation, you need the data to do that, to empower patients to be full participants in their healthcare and well-being, truly co-producing and informed to make better choices, to be a partner in their own healthcare and well-being. And to do that, we need lots of data. And not just the event data that I've talked about previously. We need all of the primary care data, the granular costing data, other sources that are available to us, like the ONS mortality data for survival rates. We also need data on clinical outcomes, and that data is often siloed and locked away within a particular national clinical audit process. We have to liberate that data and use it to far greater effect than has been possible previously. And I think in Wales, we've got a real opportunity to unlock that rich data and make it readily available for operational services, joining it together with other data to fully understand care pathways and where and how they can be improved to deliver the best outcomes. Eventually, we'll want that data to be a byproduct of the care process. But as we work towards that, we need to improve here today how we're using that data. So working with the national registries to improve and streamline the data collection and submission processes to make it readily available for all of the myriad of uses we've got for it. And of course, arguably the most important data is from patients themselves. So being able to report for themselves how they're doing, what their experience has been like, and providing real, timely, measurable feedback at relevant points of a health and care journey that provides not just the data, but also importantly, the connection into the health and care service. It's a communication tool. So used well, these interactions have the ability to transform how we engage with patients, enabling more innovative interactions. And we're starting to see now some services finally being able to move away from a traditional follow-up cycle, freeing up capacity to be able to see patients that need to be seen at that point in time. So how are we going to do this? Well, the digital community's role for me is clear. We need to lay the foundations that enable the data-driven architecture for the health and care service in Wales. Our flagship programme, the National Data Resource, one of the 40 actions that was highlighted in a Healthier Wales, it provides the technical platform and the key architectural building blocks that we need to enable data to be available, accessible and joined up. Using common data standards and terminologies, ensuring the context and meaning of data collected is not lost as it moves from one health context to another. So we can have informaticians and clinical scientists or data scientists spending less time on processing data or collecting data to report and more time on understanding what the data is telling us, working with clinicians and services to obtain the actionable insights from all of the available data that we've got. And let's not forget, we've got a fantastic opportunity in Wales. We've got national repositories of data. All of the results can be seen and accessed wherever a patient will present in Wales. We've got national repositories of documents. We'll soon have a national repository of medicines. And as we take forward the development of the National Medication Repository as part of the prescribing programme. And we'll use this rich data to develop the intelligence products, bringing together all aspects into intuitive, dynamic dashboards and insights and information products. And how will we support patients on this journey? So another pivotal programme for us that's absolutely at the core of the success of a value-based healthcare system is the digital services for patients and the public. So this programme is working with a key industry partner to develop, again, the technical architecture and to enable patients to digitally, seamlessly, importantly, seamlessly interact with the health and care. So that will use the foundations laid by the National Data Resource Programme and enable that information to be shared in a safe and secure way with patients. So it provides the gateway application to allow patients to interact with the health and care system and see information or innovation flourish on the back of those safe and secure platforms that will be created. But again, importantly, the programme has patients at the heart of the design to ensure that the apps and services are designed with patients. So there's lots for us to do in this space, and as we work together to work at how a modern health and care system becomes a co-productive and we can able to harness the many varied and valuable data that patients themselves will generate and share. So great opportunities really to build on the foundations that we're now laying. So I think to sum up, a really big year for the digital community to create the environment for Wales to truly become a value-based healthcare system. Personally, I feel really privileged to be part of that, and I've been delighted to be part of the work with Sally and the team over recent years and been delighted to be part of this morning. Diolch am wrando.
Thanks very much, Helen. And as you know, many of your team are taking part in sessions on data and digital throughout the week. So we'll look forward to that content very much. And now we come to the last segment of this opening webinar, where I am going to launch our new strategy for value in health in Wales. You know, I'm just a GP. It took me many years to figure out that policy and strategy were quite important if you wanted to deliver transformation in healthcare. And value-based healthcare really did grow from the grassroots, from clinical teams, working on small projects as Ivan highlighted earlier. But there comes a point where when you're going to really transform healthcare, you need to move away some of the big barriers to doing that. They may be financial, they may be structural, they may be in the data and digital space. And so you need everybody on your team to do that. And I think we've shown this morning that we now do have everybody on our team, which is absolutely fantastic and something that I feel really proud about. But we have to articulate this in policy and in strategy. And so today we're launching our new strategy. Our vision is the same, which is to improve the outcomes equitably for people across Wales, no matter where they're from or what condition they're suffering from. But to do that in a sustainable way so that we're making the best use of our resources. And we all have a duty to have a culture of stewardship if we believe in the NHS and we want it to continue in the way that we've all been used to. Next slide, please, Gareth. So as the Minister highlighted earlier on, we're set up as a team to enable clinical teams and health boards to deliver value-based health and care and high quality care to improve patient outcomes. We're not telling people what to do. We're not building ourselves up as an ivory tower. We really just want to help move away some of the barriers to delivering value-based healthcare. And so digital health, as we've heard, plays a key role, as does education, communication and engagement. And we're really fortunate to have now a formal education offering in Wales for value-based health and care, led by my colleague, Professor Hamish Lane, at the Intensive Learning Academy at Swansea University, which is also sponsored by Welsh Government. And many people have already been through that education programme. And of course, we continue with more informal delivery of education and engagement, like this Value in Health Week, but other webinars throughout the year, which we will introduce you to in due course. Research, industry and strategic partnerships are really important so that the whole system moves forward together towards the Value in Health agenda and how we reform our health technology assessment processes towards value and really think about radical solutions to some of the really wicked problems that we see in the healthcare system today. And we really are seeing that. And this was true before the pandemic, but is very much more so the case now, as you will know. Research into value-based healthcare financing is something which we are keen to take forward in Wales. And strategic partnerships with our international partners, many of whom I know are on the call right now, whether that's in the United States, Europe, and Australia. And we can learn from other healthcare systems and really grow this movement towards value-based health and care across the world together. Of course, none of that matters unless we can deliver impact. So yes, we do need to reduce unwarranted variation in care and low value care, but that's not enough. That's not value. Value is about improving outcomes as well. So we need to look at our outcomes in Wales and across the world to drive our approach to planning our healthcare services. So we're understanding why we're not meeting people's needs, and we can change our approaches to meet those needs as best we can. And that's why linking the strategy for value-based health and care in Wales to the national clinical framework and to all other policies like the digital strategy and all elements of the system is so important. So they're all pulling in the same direction on this. I remain absolutely committed to the delivery of person-centred care. That goes right to the heart of my general practice values. And we need to help raise the health literacy of our Welsh population. And that means providing them with the information that they deserve to make the best decisions about their health and their interventions to get the best outcomes that they can. And again, very much linked to the digital and information agenda, but also making sure that those that are digitally excluded are given the same opportunities, but in a different way. And last but not least, we continue to support implementation of value-based healthcare across the health boards, virtually all of whom now have their own value-based health and care teams in place. So we support that community of practice approach. The technical and logistical elements of implementing patient-reported outcome measures, which is quite a big change management process across the system. So it's very important that we support that. and also working with the finance community to understand the costs of healthcare across the system. And yes, that's important, because value isn't just about cost cutting, but it is about directing our resources to where they have the greatest impact and helping us to make some of those difficult choices that will be inevitable in the coming months and years. So one of the things that I've learned about value and about healthcare delivery is the importance of clinicians working not just with other clinicians and not just having a clinically led healthcare system, but those clinicians working with operational and financial managers and informaticians and patients to deliver optimum models of care together. Next slide, please. And so to celebrate this, we have a new identity in the Welsh Value in Health Centre. This is a major step forward, I can tell you personally, because it's the first time I or the team have had our own office. So it's very exciting, and as we emerge from the pandemic, we can all be in a space together physically, and we're all very much looking forward to that. But also being hosted by the Health Board in Cwm Taf really helps us think about how we embed value in health in the delivery of healthcare now. So not just policy, we're really marrying up policy and delivery. Next slide, please. And so to conclude, here's the team who I'll introduce you to in a moment. But I did want to talk a little bit about our key partners, because the strength of value in health, as we've sort of heard, I think, on the panel today, is about multi-professional involvement and about everybody pulling in the same direction across the whole country. So that means that our key partners who are not in the core team are absolutely doing value in health every single day, whether that's in Digital Health and Care Wales, in the Intensive Learning Academies, at the Finance Delivery Unit, in the National Data Resource, part of Digital Health and Care Wales, at Health Technology Wales, at the Life Sciences Hub, and CEDA, who are a key part of our team working on research and PROMS analysis in particular. And the core team here, as you can see, are a very diverse group of people with a wide range of skills that are dedicated to supporting each of the 6 goals that you saw on the previous slide. So it's my huge privilege to commend the new strategy to you, and all of you that have registered for Value in Health Week will receive a copy of the strategy later in the week. But it will also be available on our website, of course, by the end of the week as well. It's very short, it's to the point, it's visually appealing. Thank you, Gareth. And we hope you enjoy reading it. Thank you very much indeed for joining us today. And we look forward to seeing you throughout the week as we enjoy the fabulous content from across Wales and indeed internationally. Thank you very much. Diolch yn fawr.